I met Dr. Motlagh after a long struggle, after having a crown put on that didn't work at all. I went to multiple prosthodontists, another dentist who couldn't understand what my problem was, and ultimately went to a TMJ specialist who referred me to Dr. Motlagh, and it was the best thing that ever happened to me. He had said that she is very good and that she is a good person, and he is absolutely right. So I started the process with Dr. Motlagh, went into the removable orthotic, which helped resolve all of my problems. Ultimately, you know, it had to tweak here and there, but ultimately after wearing it, my jaw problems were resolved. I went to the chiropractor and was feeling much better. And just with the problems I had, I was reluctant to move forward, but today I got my fixed orthotic and I couldn't be happier. It looks beautiful, see? And I am so excited. And I, for the first time, feel like I have normal teeth. The occlusion is great, and I am so happy to be on my way to having a healthy mouth.
Great. Can you show us your fixed orthotic, please?
Yes.
Look, where is it? Where?
Yeah, you can't even see it. It's perfect color. I am so excited.
That's great. So that's the first stage into your in your full mouth rehab. Yeah.
Yes.
So
yes,
that's great. So all your symptoms were resolved, right?
Yes. Yeah. I'm doing much better, and you know, I think we even recaptured this disc on this left side, which
because there was a lot of popping and clicking, and now there's none.
And I feel like my bite had collapsed over here, and it was never the same from day to day. I'd do one thing and my bite would completely change, and it never was the same. And with the removable orthotic, I got some stability, and now this is going to just keep me from having to take it out to eat and, you know, forget to put it in, and, you know, I couldn't be
That's great. We're so happy for you.
Yes,
what were some of the symptoms that you were experiencing with a bad bite?
Just absence of a bite on the left side initially, hitting harder on some teeth right here. I had severe jaw pain over here. I had tooth pain because they were colliding and hitting incorrectly, and it was making my teeth hurt. I was having noticeable neck problems. And through the process of one prosthodontist trying to help me, she was a very nice lady, but I had some really severe neck and back pain.
Were your neck ever addressed with the bite?
With that, not with that. And then I went to another prosthodontist who took everything off, and then it was a really bad time for me.
What was the solution? Was it what was the solution that they offered?
Grinding my teeth off.
Oh, I see. Okay. For equilibration or
and it just kind of exacerbated the symptoms in my jaw.
Did you do it? Oh, you did the grind.
Well,
okay.
He just did it.
Oh, okay.
He didn't ask me. He just started grinding, and before I knew it, everything that, you know, had been corrected by one prosthodontist was just gone. And then I started having the bad jaw pain again. None of it was right like it is with the neuromuscular. It was just kind of guessing and adding and taking away, and it just wasn't right. It wasn't comfortable, and this is just spot on. This is so...
That's great. Now that you've gone through this, what is one thing that you would change? You mentioned earlier that with the removable, you put up with it for so long.
I would have done this a long time ago. Yeah, but I was very apprehensive and scared and nervous, and you know, I didn't want to do anything permanent. Just kind of in maybe a little denial. Financial was kind of a concern for me as well, but got that worked out.
Do you see the value in it now?
Absolutely.